The United States Air Force has detected unsafe levels of a likely carcinogen in underground launch control centers at a nuclear missile base in Montana, where a striking number of men and women have reported cancer diagnoses. The discovery is the first from an extensive sampling of active U.S. intercontinental ballistic missile bases to address specific cancer concerns raised by missile community members, the U.S. Air Force Global Strike Command said in a statement on Monday. In the samples, 2 launch facilities at Malmstrom Air Force Base in Montana showed PCB levels higher than the thresholds recommended by the Environmental Protection Agency, EPA. PCBs are oily or waxy substances the EPA has identified as a likely carcinogen. In response to the findings, General Thomas Bussiere, commander of Air Force Global Strike Command, has directed immediate measures to begin the cleanup process for the affected facilities and mitigate exposure by our airmen and guardians to potentially hazardous conditions, the Associated Press, AP, reported. After a military briefing was obtained by the AP in January showing that at least 9 current or former missile staff at Malmstrom were diagnosed with non-Hodgkin lymphoma, a rare blood cancer, the Air Force School of Aerospace Medicine launched a study to look at cancers among the entire missile community, checking for the possibility of disease clusters. Non-Hodgkin lymphoma is a blood cancer that uses the body's infection-fighting lymph system to spread. But there could be hundreds more cancers of all types, based on new data from a grassroots group of former missile launch officers and their surviving family members. According to the Torchlight Initiative, at least 268 soldiers who served at nuclear missile sites, or their surviving family members, have self-reported being diagnosed with cancer, blood diseases or other illnesses over the past several decades. At least 217 of those reported cases are cancers and at least 33 of them are non-Hodgkin lymphoma.